Neglected tropical disease, or NTD programs, are increasingly integrating and expanding, creating a need to track more and more data for budgeting and planning purposes. At the same time, NTD programs need to improve the accuracy of estimated costs and funding gaps, and be able to transparently and effectively communicate them with partners and donors. So RTI International developed the Microsoft Excel-based Tool for Integrated Planning and Costing, or TIPAC, to assist ministries of health and other users to plan and accurately estimate the costs and funding gaps of public health programs. The tool is user-friendly, accessible in multiple languages, and recommended by WHO. The TIPAC helps countries to facilitate planning of integrated NTD control programs, generate projections of drug needs for up to 5 years, accurately estimate the cost of program implementation, quantify existing funding, identify program funding gaps to share with potential donors, and complete the forms required in WHO's Joint Application Package, the Joint Request for Selected Medicines, and the Annual Work Plan. The TIPAC leads users through the process of entering data specific to their country, like population figures, disease data, local unit cost information, and cost for planned program activities. Users have the flexibility to enter very detailed costs by line item or lump sum estimates, depending on the information they have available and the level of detail they'd like in the reports. Data can even be copied in from other Excel files. After country-specific data have been entered, the TIPAC produces a number of useful reports, like the Annual Work Plan Matrix and Timeline, which provides a comprehensive view of all program activities, when they're scheduled to take place, their costs, and which activities need additional funding. Demonstrating these funding gaps by activity can be especially helpful when communicating with potential donors. WHO recommends the use of the TIPAC-generated matrix and timeline to complete its annual work plan, a requirement for countries to request PC drugs through WHO. The TIPAC's Total Program Cost Report shows costs by activity and as a percentage of total program cost. The control panel allows users to change the currency, level of activity costs, and categories to, for example, show the country's own contribution to the program by including government salaries and customs clearance fees in the report. The TIPAC also produces a report of the drugs needed, already in stock and donated, in the remaining gap, very important in helping countries accurately estimate the amount of each drug needed. Drug need can be displayed in terms of units or dollars. The TIPAC can even help countries forecast the drugs they'll need for the next 5 years. It generates the WHO Joint Request for Selected PC Medicines. The tool pre-populates the country information and drug worksheets, and automatically calculates the drug need. The MOH just needs to review, sign, and complete the remaining summary and shipping information for the request to be ready to submit to WHO. The TIPAC is also easy to update year after year. After the first year's entry, users can populate the tool using stored information from previous years. All TIPAC data and results remain owned by national NTD programs. The tool is flexible and allows users to add other diseases. RTI has even adapted the tool for HIV/AIDS programs and indoor residual spraying programs for malaria control. There's also a generic version of the tool that can be applied to any type of public health program. The latest version of the tool, TIPAC 3.0, is freely available on the Envision website. The TIPAC 3.0, or an earlier version, has been used in at least 17 countries. Nigeria recently used the TIPAC to complete its WHO Joint Drug Request Form for PC medicines, saving weeks of staff time. In Haiti, using the TIPAC enabled the Ministry of Health to strengthen its coordination of activities with external partners and NGOs. In Nepal, TIPAC implementation highlighted integration opportunities across diseases. And in Sierra Leone, the TIPAC showed that morbidity control and surgery were underfunded, which led to continued donor commitment. To download the freely available TIPAC or for more information, visit the website of RTI's Envision project.